Responding to university settings requires a different approach. As we all should know, when we respond to a workplace setting, it's important that we talk with our point of contact to learn a bit about the organization and its culture. When we understand some of the basics of the organizational culture, we're able to deliver better, more appropriate interventions and education. There may be significant differences in responding to a bank branch or bank headquarters, manufacturing plant, or a multinational corporation that sells services rather than goods. When we're called upon to respond to a university setting, it will be even more important to understand some of the more general concerns that the university has, in addition to the specific culture of the campus. In addition to many of the same concerns of leadership of any organization that has been struck with a disruptive event, the university is also concerned with fulfilling their duty to provide a safe learning environment, protecting reputation and assets, assuring the public that the university is safe, responding to alumni and funders, resuming operation as soon as possible, and of course demonstrating care for students and employees. So when we think about circles of impact, we need to think about multi-levels in a university. We have the students who may be directly impacted, but a much larger student body who might be peripherally impacted or not impacted at all. In addition, we may have faculty members who are directly or indirectly impacted because of the relationship with the students. On top of that, we may have campus security personnel to talk to or the campus counseling program. And if that's not enough, we may be consulting with the university leadership about alumni relations and getting information to parents. Yes, even though most of the students will be young adults, they're still children in their parents' eyes who must be protected. It is my experience that responding to a university setting is one of the most potentially complex responses that we ever do, short of a major disaster. And this is because of all these varying potential candidates for our educational approach to helping after disruptive events. If the event involves some members of the student body as victims, usually the primary target's going to be other students. If it's faculty, while our primary targets may be other faculty members, we're also likely to be called upon to assist with students as well. If the event involved the death of a student, whether it be by a health event, violence-related, or suicide, it may be the first time other students have experienced a peer death. If the perpetrator of the event is unknown and not yet arrested, fear can abound throughout the student body or even the entire campus, including faculty. So what are some of the things that we might want to assess as we begin our work? Well, following a crisis, the leaders of the organization and we must assess what are students likely going through, what are staff likely going through, what's the organization going through, what are some of the meanings of this or the factors that lead into it, and lastly, what can I do? Well, there's some basic core principles that I believe are helpful to frame our interventions in this setting. One, of course, is to remember to provide social, occupational, organizational support. We want to help contextualize the traumatic experience. That is, help people understand it, help with them dealing with their reactions to it and so forth. We want to appropriately address perceptions of guilt and self-blame, anger and grief. We want to challenge those dysfunctional thinking by reframing them whenever possible. We want to facilitate and encourage the use of appropriate coping strategies, facilitate early help seeking for those who might need it, help individuals understand the correlation between their sense of personal efficacy and resilience, provide and demonstrate expectation of recovery, and provide strategies for self-care and re-entry into life and education. Provide and demonstrate expectation of recovery. Just like when we're responding on the behalf of an EAP, it's important to remember that we also represent the university as we talk with its members. It is vital that we help to position leadership in a favorable light and assist them in helping their organization. Sometimes this means working with staff members, sometimes with students, and in rare occasions, perhaps other community members. So the potential contacts and often the high emotions that come from disruptive events, providing interventions in a university setting can take its toll on the consultants. And while I think it's always a good idea to have a plan of recovery after providing interventions in general, I think it's even probably more important when we're responding to a university setting. So plan to take a little downtime. Do something nice for yourself to process the experience that you've just been through. And as always, the clinical staff at R3 are available to be of assistance to you. We've all been there, done that, and some of us own the movie rights. We're glad to be of assistance. Thank you for watching this edition of Inside Crisis.